Hi, I'm Melanie Marie Boyer, the Executive Director of the Pittsburgh Metropolitan Area Hispanic Chamber of Commerce. Welcome to our Latino Pittsburgh Digital Speaker Series, sponsored by Coca-Cola. Thanks, Coke. Today we have a very special guest, a friend of mine, a member of the Chamber, and a very important individual in the community at large. We have Angela Garcia, the Executive Director of Global Links. Hi, Angela.
Hi there.
Thank you so much for taking the time to be with us today. I know you have a million things to do. You have such a big impact both locally, nationally, and internationally. We're really thrilled to hear about it. So thank you.
No, absolutely my pleasure.
Well, I want to start by learning a little bit about you. First of all, tell us how you're tied to the Hispanic community.
Well, I am a native Pittsburgher, but I boomeranged back after being gone for about 10 years. And my husband is an immigrant to this country, and I had lived in Mexico for the 3.5 years prior to bringing him back and seeing what Pittsburgh was about back when we were newlyweds and we started a family. And I found my job working here at Global Links, and that is directly connected to Latin America, all of our work. So I had the privilege of then growing a program to serve the local community, which includes the local Latino community. So I'm connected personally. I'm the proud mom of 2 Latino teens, and so lots of connections.
While Angela might not be Latina by blood, we claim her. And we're so glad for all the work that you do here and in Latin American countries. But what led you to your job at Global Links? What's your background?
Oh, great question. So I had never left Pittsburgh up until that wonderful decision I made to go to a small liberal arts school and travel the world, because I never had a passport before graduating high school. And that was just, a pivotal moment for me. And I went to college to study violin performance. And after a year and a couple trips to visit friends in different countries that I made in college, I changed direction and worked towards a degree in international relations, thinking I would go into some type of policy work, head to DC. But I decided to move to Europe, as that is where really my studies had been focused, and worked in senior care in Brussels, capital of Europe, for a year, and realized I was not a Beltway person. That was just not the right fit for me. It's very similar, Brussels, to the DC mentality. So I changed course and moved to rural Mexico and volunteered with an organization there that also ran programs for unhoused youth, as well as children in facing challenging home environments, whether it be domestic or sexual abuse, and a senior care facility. So that umbrella organization had a lot of things that I was interested in. And then I started working with their mobile medical clinics. So run by a Mexican doctor, but visiting villages that were primarily Mayan residents. And I was teaching women's empowerment classes, so basic hygiene, Spanish literacy. So I was teaching Spanish in Mexico to Mayan speakers, which was just an amazing experience. And working alongside that medical doctor and just seeing the need for primary care services, regular, dependable, culturally competent health services. I'm not a clinician, but just those basic sort of access to services that I took for granted. And that was really sort of the second pivotal point for me. So after living there, getting engaged, getting married, and moving back to Pittsburgh temporarily until we figured out where we were going next, that was in 2000. And my husband relocated here and didn't speak English, so he's had his own path. And together, Pittsburgh has just been a wonderful place for us to, build our lives, build our family. And he now works in healthcare, now speaks English. We have And it's just been really wonderful opportunity then to get our kids involved in sort of that global mentality, global perspective, growing up in the service world that I'm in, but healthcare as well. So it was just a sort of a natural progression, but some key moments that connected my exposure to health services and basic human rights to what we can do here in Pittsburgh.
I think that that's beautiful. Pittsburgh is such a great place to raise a family, and such I would say, an easier place to make an impact than so many other large cities. But tell us about your experience in growing your career, having impact, and being a mom all at the same time.
Well, so when I started, because I feel that this is, I'm sort of that middle generation, right? People that I worked for, the baby boomer generation, so many people in the nonprofit sector started nonprofits, worked for nonprofits or corporations for most of their life, right? Our founders, all three of them, founding mothers, they stayed at their job for decades. And I had the privilege of working for one of the founders here for 10, 15 years. And as women, primarily single women, they prioritize work-life balance. So I had access to a lot of flexibility, and I was set up virtually during my first maternity leave, which was, my son is now 17, and they brought me a laptop and a cell phone, and that was really, there was no pressure, but it allowed me to stay connected. And thinking about that now, that's sort of what we're all set up to do. But we were a small organization. There were only 8 of us at the time. So really having a job while my husband was attending nursing school and we're raising 2 young kids, I had to keep working because he needed to keep studying. And that really retained me here. And that's something that I try to maintain here at Global Links, is a work-life balance for all of our employees and all of their needs throughout life, because we are either caring for someone, they're our parents' generation, our grandparents' generation, our children, our community, so many different needs. But that was really the first 10 years of working here in Pittsburgh. I didn't have a lot of time outside of my daily work here at Global Links, supporting the organization, helping it to standardize, but not really that much outside of our building, right? And then as my kids got older, my husband got established in his career, and our founder announcing her intention to retire really allowed me to then sort of start building, the Global Links for the next 30 years. And now that, as our kids are being launched and looking for their college path, it really gives me that freedom to, the office is in good hands, our programs are in good hands, and now we're envisioning what our future programming, additional programming, and our next phase of growth is. So Global Links' role in the community has just allowed me to have that flexibility and to continue building and engaging more of our community and connecting this region to the world.
Well, you have come so far, and so has Global Links. You have grown it tremendously. But first, before we get into that, for the audience that doesn't know, why don't you tell us, what does Global Links do and how did it start?
Absolutely. So Global Links was founded here in 1989 in Pittsburgh by 3 women who had traveled around the world and worked in healthcare, but were not clinicians. And so between those travels and their experiences, they had noticed that there was a great amount of humanitarian aid donated from the United States to other countries, but most of that aid was moved through traditional channels, so distributors and manufacturers, to countries and communities around the world, whereas they thought, and they were correct, that there was surplus sort of built into the clinical setting. And that's where we were founded, to really partner with hospitals, senior care facilities, physicians' practices, sort of in the clinical setting, to identify materials, many of which are new, very gently used, or have a long life ahead of them. So things like what you would see in your doctor's office, if your doctor decides to remodel, rebrand, is purchased by one of our healthcare systems. There's oftentimes a lot of remodeling that it's really a luxury we have here in the United States. It doesn't mean that all the furnishings and the exam beds and tables and things are not functional. So that was sort of the genesis of the mission, was where do we identify new resources, material resources that can improve the quality of care, the dignity of care in lower to middle income communities around the world. And that is what we were set up to do around their dining room table. Now 32 or 33 years later, Global Links works with hospitals, corporations, universities, individuals, consumers. We are all consuming our medical health services, and oftentimes are discharged with durable medical equipment like wheelchairs and walkers, or family members that need those items at home. But the treatment may be over, the break heals. All of these items that still have good quality and life left in them, we now have surplus collection programs set up across the state, into Maryland, West Virginia, Ohio, and New York. And then what we do is our program team builds partnerships, builds relationships, both in countries throughout this hemisphere, and works to meet with community leaders, healthcare leaders, national leaders, and where they're looking to improve health for their communities, and how can materials that we have access to be part of that program. And then we do the same thing here, partnering with other nonprofits who are client facing, so who are doing case management, who are attending our unhoused population, who are supporting with case management our immigrant refugee population. Any needs that are maybe not covered domestically by Medicaid or by SNAP benefits, which the materials are amazing, what's not covered. Personal health and hygiene products, soap and basics that we don't even think about. Those aren't covered by food stamps or SNAP benefits. For seniors, simple items that can keep them safe and prevent falls, and keep them dignified and living independently, like incontinence products, or like the shower and bathing benches that help many of our seniors bathe safely. Those aren't covered by Medicaid. So that's where we come in, and we provide those materials to the partners who are assessing the needs of our resource-challenged neighbors, and really complete that cycle. So we rescue the surplus and we get it back to neighbors in need.
That is amazing. I love how you talked about the work that you do here, because I think so many people, in the name Global Links, and so many people hear about the outreach you've done, especially to Latin American countries, and they think that that's all that you do. So I'm really interested to hear, what do you think is your favorite story or memory working locally?
Wow. So I love the fact that we now have a local program. It started a few years before COVID was really modeled on our international program. Again, it requires partnership. It requires relationships with either the caregivers or clinicians who are providing direct care, and we can bring those resources. But one of my early favorites, and again, I worked for 2 years in senior care, and it was very clear that was not the right field for me. I have tremendous respect for the people who have the patience and the compassion to work with all of us in our last years, because it is a really trying time. But if you're low income in the United States, it is very challenging to grow old. It is challenging to grow old anywhere. But here, the one thing that stuck with me was this woman in actually Braddock, who came to one of our first events in that community. This is pre-COVID, years ago, and had seen that we had partnered with an organization there, and had set up some walkers, had set up Depends packages, new packages of Depends, and came to the event and said, "Are those available?" And that week she got a walker, and she's like, "This is going to make it so much easier for me to get from my house to the farmer's market and back." Wonderful. The next event, she was back, and she had the walker, and she pointed at the Depends. And this is a sensitive subject, but I worked in senior care. 40% of us, all genders, all socioeconomic backgrounds, all racial backgrounds, will face some health problems. Muscles get tired later on in years. And she said, "Are those available?" We said, "Absolutely." She said, "They're really expensive. I know someone that can use them." And so she took a couple packages and put them on her walker with a bench and walked on off. And her daughter came back to us and told us that they were actually for her. And by having those, adult briefs, she could go out more frequently and the way she used to, without fear of embarrassment, without fear of an accident. And I know that's not the sexiest story. Not everybody wants to talk about that. But to me, that's what we're doing at Global Links. We're really trying to improve the health, dignity, and mobility of our neighbors locally and globally. And so it's not about the materials, it's about making those connections and really providing people with basics so that they can continue to live the lives that they want to.
Well, we can't get to those, more involved or quote unquote sexier stories if we don't have the basics. If we can't walk, if we can't eat, if we can't sleep somewhere that's healthy. So thank you for that. I love it. I want you to tell us a little bit. I know that you guys do so much with community outreach and community involvement. Tell us about what you guys do in that area.
Absolutely. I say I love my job because I get to work with literally everyone in our community. There's an opportunity for everyone of all ages. We've really worked hard over the past 10 years to establish service or volunteer opportunities for everyone from young children, families with young children. We have special volunteer 2-hour service projects, minimum commitment. It can be once ever, it can be once a week, it can be once a month, but we have programs that go up through professionals, so corporate volunteer programs, companies that are looking whether for a service day, for a hands-on activity, for now team building, or maybe we're in virtual offices, really reconnecting people. We set up customized experiences for groups based on what they're looking to do. We have meeting space, eating space, and then the service space. So really putting that out there. Retirees, we welcome a lot of our retired community students, just really lots of opportunities because our volunteer program runs 5 days a week, Tuesdays through Saturdays, and the literally hundreds of tons of surplus that we are collecting and gathering all have to be quality checked. The dates have to be checked. It's amazing. Even toothpaste has an expiration date on it. And we have to abide by that, right? There are regulations, particularly with import-export, and we have to make sure that we're not furthering a double standard. So everything has to be checked, counted, like item grouped. So we set up products, no experience necessary, but really tell people the story of the resources and sort of the magic of this model, right? It requires the volunteers to connect the surplus and to convert it into life-saving and life-improving donations, because we want to get exactly what people need from what we have. So it's not assorted. If we're working with a pediatric project, we want to make sure we get them only pediatric kids supplies. If we're working with a senior care project, we want to make sure we get them only materials that way. And that's where the volunteers come in. And so them being a part of whether a shift to, sort vaccination supplies, or to support sort out masks so that we have those all sorted, kind of packed, and really prepare that. So it's not just the sorting and the counting, it's actually preparing the donations that help us to respond in real time to disasters, local disasters, flooding, building collapses. When people are displaced, we partner with the disaster response teams here in Allegheny County, but also natural disasters, things happening around the world. When those materials are ready and on our shelves, our staff can go into action and really start working with the community affected and make the needs. So that's one way. People that want to come in to our volunteer center, we're located in Green Tree, but we also have virtual volunteer opportunities and service projects to help meet that need for personal health and hygiene products. It's amazing. I mentioned soap, but shampoo, deodorant, toothpaste, toothbrushes, none of this is covered under SNAP benefits. So people that are in a challenging employment time, maybe facing unemployment and relying on food assistance, they cannot use their food assistance benefits to buy any of those personal health, menstrual products, period products, diapers for babies or adults. So we started a project that whether it be scouts or students or anyone can do collections, but they can also assemble these kits for us. And all the instructions are on our website, downloadable. And then we have a speakers bureau. So we get a lot of educators that approach us and want, a talk on our work in maternal health, for college groups, or our work in global health for high school groups, and how we're connecting an environmental sort of issue with improvement of public health and basic health around the world. So lots of different opportunities. And we also offer tours, so people can come in, get the 30-minute overview, either virtually or in person, and talk with any of our team who do our community engagement experiences and see what's right for them.
I love that. And I don't want to leave out that the benefit is not 1, 2, 3, 4 sided. Tons of people benefit from what you guys put out and, the support that you provide. But let's talk a little bit about the benefit to the people who are coming and doing the sorting, especially on the corporate side.
We have heard, for years how people, had no idea that this was even an issue, right? And when you come in, we have a 58,000 square foot facility. It is constant motion of materials. It's like a processing center, all of which would have been landfilled or discarded if it weren't for our partnerships, in sourcing that material. So we have companies of corporate real estate to local, small businesses come in and say, our team, our staff, they had such an amazing experience because they didn't realize this was an issue. They're now empowered they'll never look at, crutches on the curb and be able to drive by again, or they'll never look at their doctor's office the same way again without asking questions. But to be aware of that, about what we as individuals can do, and about what those gaps are, both in our national healthcare system as well as in our global healthcare inequities. And a lot of the communities we work in trying to bridge those inequities, they are communities of color. Even throughout the Americas, we're working a lot in Afro-Caribbean descent communities. We're working a lot of indigenous communities. And there are ways to work effectively and address these inequities. And that's what drives us every day. So the more people get engaged, the more we raise that awareness, the more we raise awareness of what can be done. And people of all backgrounds and abilities are fully accessible. They can be a part of it. And there isn't a global links in every city and every healthcare, hub around the country. So it's something that's unique and special. And, in Pittsburgh, I'm a Pittsburgher, a native-born Pittsburgher, and, we do things together. We are very community driven and we want to do it the best. So we impart that education, awareness, and, next steps. How can people continue this? How can people, keep us going? They've kept us going for 32 years. And without that community engagement, our model wouldn't work.
I absolutely love that, and how much you've grown the organization, not only just through the time you've been there, because we already heard a little bit about that, but let's talk about the extreme changes that you guys have gone through just since COVID and your impact has grown.
Absolutely. So when COVID started, if we can all, let's remember back then, my staff and I were just coming back from actually an evaluation trip in Honduras. And we had been working in Honduras on a dengue mitigation project, which just seems so far away. But dengue is, mosquito-borne illness. It's so prevalent in countries south of the U.S. border. And it was a particularly serious outbreak that was causing some deaths in the community. So we're all focused on that. We come back to Pittsburgh in March 2020. And we're debriefing, and the news comes out. And really, I looked around the room. The staff's like, what are we going to do? We all came together, board, staff, and decided we were going to, close the doors, but pivot all of our staff efforts to do as much as we could locally. Why locally? Because we know from working in disaster response around the world, the best response to any disaster, and we recognize it as a public health disaster, is to work as close to the affected community as possible in terms of your sourcing, your purchasing, put the dollars back in the local economy as much as possible, don't waste resources moving things to any great distance. And really, that's what we look to do. We look to how can we source products that are going to be needed and support our nonprofit peers who don't have what we have, which is a large warehouse, delivery trucks, inventory management system, knowledge of healthcare and medical products. And within a few weeks, we had already connected with many organizations, I think known by the chamber members, Casa San Jose, Latino Community Center, and then we looked at other immigrant and refugee communities. Those were the first people we reached out to because the language breakdown, they weren't even aware of the mask, that the leaders of those organizations were aware of the mask mandate, but getting masks out to everyone. And then it grew from there. Well, what about the unhoused population? Well, there's all the nonprofits. We wanted to ensure that their staff, as well as their clients, residents, patients, had protection, right? Had the masks and the face shields those first few months. And then it progressed. So all of the low-income senior housing to childcare centers, as they were getting back up and running, we received support from our local corporate and philanthropic communities to do sourcing. And we were able to keep almost all of that purchasing within southwestern Pennsylvania. So working with local companies who had adjusted their production lines, working with local maker shops. And we did about $2.5 million in sourcing compared to $250,000 the year prior to COVID. And, we're really proud that we kept those dollars here in Southwest PA. And then we're able to provide the products to the nonprofit community who was caring for our most vulnerable neighbors during the really 18 months of what we saw as the critical response period. And that meant we grew from 30 partners locally, 30 agencies pre-COVID, to over 1,200 organizations we worked with at the end of the 18 months to provide them everything from that original PPE to the cleaning products and the sanitation, everything they needed for disinfecting and keeping a clean environment, whether in a childcare setting or in some of the sheltered populations. So all of the women's shelters and the vet shelters, we kept it here in Southwest PA because we had to limit how far we reached out, but the most effective was engaging with all of those who are closest to us. And we're really proud of what our team was able to do by staying focused that way.
Well, we are extremely proud as well, especially to have you in the area. I personally know quite a few people who you have affected during times of disaster. And on a personal note, even myself and my own disaster, not even as an organization, just as a human, you are a tremendous individual, an amazing organization. Where can people find you and how can they get involved?
Anything they would really need to know, globallinks.org, our website, very up to date, maintained our social media, Facebook, Instagram, Twitter, and LinkedIn. Me personally on LinkedIn, we are regularly communicating lots of activities, events, engagements, service projects. When it's the back to school season, students needing service hours, college and high school teachers looking for content. We can now transmit virtually any of our field, I don't want to call them field trips, but really reports from the field. We have great content from our International Medical Aid Department that really shows what the impact of this work here in Pittsburgh can have in partnership and community-driven in countries like Bolivia or Honduras and Nicaragua, places we don't usually get to see up front and personal on mainstream media. And people can call our office for information, but all of our staff works hybrid, is happy to engage, and lots of different opportunities as people look towards the holidays, want to do alternatives to gift exchanges, really a way to give back to their local neighbors. We're happy to partner with you.
Well, thank you so much again for joining us today. Thank you for all that you do. Thank you for being a friend. Just thank you for being you.
I am happy to be a part of this community, and we all have to do what we can do. So it's really by being open, transparent, and putting all of our strengths forward, which I think this community has a lot of. We have our challenges, but we can make it better together.
Better together. You heard it from Angela. Be sure to connect with her on LinkedIn, connect with Global Links, and get out there and volunteer, guys. And thank you for watching our Latino Pittsburgh Digital Speaker Series. The Speaker Series is an initiative of the Pittsburgh Metropolitan Area Hispanic Chamber of Commerce. Its goals are to share relevant information, inspire growth, and foster opportunity. Speakers and workshops include community leaders and members, as well as other individuals and programs that have a positive impact on not only the Hispanic community, but the region at large. If you'd like to become a speaker, please email chamber@pmahcc.org. If you'd like to become a member or get more information, you can also visit our website at www.pmahcc.org. Thank you also to Coca-Cola, our sponsor, and we hope to see you next Wednesday.